holds many mysterious conditions that even scientists and medical doctors are still trying to understand. One is happy hypoxia, where a person's oxygen levels are so low, forcing those with such a condition to faint or experience organ damage. Our reporter Dorcas Wangira explores these baffling mysteries and tells you why, even at the slightest symptom of illness, you should seek medical attention.
Barely a year in the wake of a global pandemic, there's so many mysteries baffling scientists and doctors about COVID-19. Why does it cause mild disease in most people, but then turn fatal for others? COVID-19 is primarily a respiratory illness. A severe case can reduce the amount of oxygen that the lungs can absorb. Blood oxygen levels have been found to be very low in some COVID-19 patients.
What does COVID, the virus, do to the lungs? It really messes up the lungs and destroys, causing scarring and stiffness, and no gas exchange is taking place. And therefore, someone dies like suffocating in the plenty of air. And that is why we then say that this person died from difficulty in breathing, they couldn't breathe well, and so it is attributable to COVID. Not just anyone who has COVID will die from it.
You can have a very serious COVID disease condition, but you may not be aware. You would behave normally, but when you reach the hospital, the doctors will quickly usher you into the critical care when they look at your oxygen saturation. So there's something in COVID called happy hypoxia. It means your lungs are not working optimally, but you feel otherwise well.
If blood oxygen levels continue to fall, the organs may shut down and the issue becomes life-threatening. The problem with happy hypoxia, also known as silent hypoxemia, is that the patient should be fainting, experiencing shortness of breath and difficulty in breathing, chest pain. But they are not, until they eventually collapse, and in most cases it is already too late. August 2nd, Kenya has recorded 369 total COVID-19 deaths. The lack of having the symptoms and signs that would help doctors save patients in good time is what is a major concern.
One of the contributing factors to the increasing number of deaths, of course, could be patients presenting late.
You realize the ministry has really upscaled, trying to make sure that they identify anyone with pneumonia-like symptoms or any difficulty breathing.
A study by the Loyola University documents that normal blood oxygen saturation level should be around 95% or more. But with conditions like pneumonia that affect the lungs, saturation levels drop below 94%. Levels below 90% are too low. It is also suggested that COVID patients who are either older than 65 or are diabetic may be more prone to silent hypoxia. When the body is fighting off the SARS-CoV-2 virus, it may also start to attack its own cells and tissues. In many of the severely ill patients with COVID-19, their blood has high levels of immune system proteins known as cytokines. Cytokines are part of the body's immune response to infection, but their sudden release in large quantities can cause multi-system organ failure and death. This is known as a cytokine storm. It eats away at the lung and one cannot recover. This seems to play a role in death in a large number of cases. It can be triggered by infections like the flu. In a study of patients who died of the H1N1 flu, 81% had the features of a cytokine storm. While a sign can be seen by someone else other than a patient, a symptom is what only the patient can feel and must communicate to a healthcare worker. You may look fine, but health monitors could show something different. To prevent more COVID-19 deaths, Kenyans are urged not to take any symptoms of illness lightly, even at the onset. Health clinicians should also be on high alert treating patients. A patient could be stable at one moment and within a very short time degenerate to a critical condition.
And it's important, and listen very carefully, Kenyans, to this information, that if you feel unwell, please seek for healthcare services support.
Dorcas Wangira, Citizen TV, Nairobi.